Hello, myself Dr. Ankita Mandal, consultant gynecologist, infertility specialist and laparoscopic surgeon practicing in Kolkata. Today, we will be talking on a very burning topic, that is infertility. Now, when should a couple visit a fertility physician? Well, I have seen patients coming to my clinic complaining that, ma'am, I have tried for about 3-4 months, but still we are not getting any results. Now, what is infertility? Infertility is defined as when a couple has actually tried for 1 year unprotected intercourse at a regular frequency. And what is regular frequency? At least 2 to 3 times per week. And by the end of 1 year, still if the couple has not conceived, then definitely it is termed as infertility. But there are certain conditions. If the woman age is more than 35 years, or if the woman is having any known past medical history, like if she had a history of PCO or endometriosis, or she has suffered from genital tuberculosis, or has received any chemo radiation in the past, then they should definitely visit the fertility physician before 1 year. Now see, the infertility cause may not always lie in female. It can be a male factor also. So we need to find out the cause not only in the female but also in the male. So we do a battery of tests both in the male and female to find out the causes of infertility. So to start with, we do a semen analysis in male partner. Normally the semen analysis should be done after 2 to 3 days of abstinence. It should not be at a more, after a long period of abstinence, because that can also give false results. Now coming to the female factor. Now the female factor can be a problem in ovulation, it can be a tubal factor, or it can be a problem in the uterus. So we need to find out where is the cause. So if the ovulation is not happening, the patient might have PCO, she can have endometriosis also, or it can be a cause of premature ovarian failure. So we do certain hormonal tests to assess, and also we do a TVS folliculometry to see if the ovulation is actually occurring or not. For the tube test, we advise the patient to do a hysterosalpingography or a saline infusion sonography from 7th to 10th day of the cycle. For the uterus, we need to see if there is any fibroid, if there is an endometrial polyp. So we do different scans like TVS scans to rule out these things. So after the end, if we are not able to find any cause in male or female, then we call this at unexplained infertility, which is also very common. About 1 in 3 couples suffer from unexplained infertility, where we cannot ascertain a particular cause to infertility. But yes, with different treatment, we can treat infertility nowadays. We begin the treatment with simple management. We give some medicines for ovulation, and we ask the couple to try for a couple of months. And if still we don't get any results, then we move to some injections also. We can again resort to IUI also. And if still we don't get success, then the last resort is definitely IVF or ICSI. Now, I have seen patients coming with prior treatment, and where they have not been tested for tubal factor or semen factor, and they have been given medicines for ovulation induction. Well, but this is not right. We should actually try to find out, and we should try to exclude each and every cause of infertility before we switch to any ovulation induction. So that's all from my side. Thank you.